Start right now.
So now we're going to film the Dermaroller. We've done a facelift in the past and a few small things, and everything looks really
Can we
good.
a mini facelift?
Mini facelift, okay. Yeah.
Just that.
Just a little mini facelift. Yeah.
It was a pinch.
No, a pinch in the past, but everything looks great.
And the chin, which we love.
We did a little chin.
So now we're doing a bit of maintenance.
So this is called the Dermaroller, and this just has little tiny needles on it that we're going to roll back and forth, and it's going to create 100,000 little holes. Those holes will have to close, and as they close, it will tighten everything up. And they're just deep enough to actually stimulate a little trauma, which is what we want. That trauma will then stimulate collagen formation, which will give an overall improvement to the skin's elasticity, texture, and everything. It's going to be great. Okay, tilt your head back, turn this way. Okay, so now we have numbing cream on. If you don't have numbing on, this hurts because these are little needles that go back and forth. But if you give the numbing enough time to work, this really doesn't hurt that much.
I really can't feel the needles this time.
There are some parts where you're going to feel them, but overall, you can't really feel them. And this is just deep enough. You're going to see some little pinpoint bleeding, which is what we want. You know, the difference between this and the home Dermarollers, there are home use ones. They're not really deep enough to really do much. They don't cause any bleeding. They're not deep enough to really create a benefit, but they may have a little bit of benefit for use, but not nearly the amount of benefit that this gives.
And how long do you see any results?
Well, you'll see results. You'll feel it tonight.
Okay.
You'll feel your skin's tight. You'll feel it's really.
Oh yeah, I remember when we did it that time before, and you're not allowed to put product on your skin today.
Yeah, not today. Okay, so I go in 6 directions. That was vertical. Here's horizontal. And I have every laser on the market. I think this is just as effective or even more effective for certain types of skin. Some people would require a laser, but I think this is just as beneficial or more so for me.
When you did it for me before, I saw a huge difference. I did.
In the texture?
And tighter. Yeah. Well, you're going to see little red marks now.
Yeah, I see them. Yeah. That goes away.
Oh, by tonight you look great.
Yeah.
I mean, you look terrible for the next couple hours, but by tonight.
Thanks.
Just when I say terrible, I mean red. You look bright red.
She's helping me. So.
I'm here now. Dr. Feldman looks good. He lost weight. He looks really good.
Now I'm going in a oblique direction.
How's Nick? Was he excited?
Yeah.
Is he going to come see your office when we've done it?
Yeah.
So now we've just completed the Dermaroller. We did this area, this area, this area, and I'm just finishing the forehead. I've got a few more strokes left on the forehead. And the forehead can be a little sensitive because it's such a tight area. Just a few more strokes and we're done.
Thank you, Dr. Diary.
Oh, you're welcome. There we go. Okay. So what you see here is your bright red, which is great because this creates a huge rush of circulation to the skin, which is fantastic because that blood gets in there and just kind of refreshes the skin.
Right.
There's hundreds of thousands of little holes that now have to close, and as they close, you get a little tightening. And long term, there will be some collagen formation and stimulation because of the trauma that's gone deep to the skin. So this has multiple benefits, and you're red now. In 8 hours, you look great. Okay, and by tomorrow you'll feel your skin's tight. You'll just feel great.
Beautiful.
Yeah.
Thank you so much, guys.
You're
Awesome.
welcome.